All right, at this point, we'll take our straight number 8 cup serrated curette. Show you that. We'll stick it straight in. And then you can spin it and angle it and torque it. And it's basically just for the area that you've debrided using the hourglass shaver, but sometimes you can get some additional tissue. And then we'll use the angled curette. And I want to show you a nice technique that we use to both get the end plate of the disc. In this case, we're going to use the left-sided angled curette. I'm going to put it in and spin it that way against in this case, the inferior end plate of L5. And we're going to be across the midline, way to the far contralateral side. And then we'll just engage the tissue, and then we'll just go ahead and spin it with our hand. And then remove that tissue. And then we can use the right-angled cup curette, as we see that way, and we'll put it across the midline, and then we'll spin it like that, and it just will take a nice chunk of the cartilage, cartilaginous end plate off, removing cartilage. See a piece there. And then we'll use it to debride the ipsilateral corner of the disc space. We'll put it in upside down. For instance, this is the left angle. So we'll put it in and let it sit that way. Put it in the gutter, in the far ipsilateral anterior corner, and then pop the cartilage off that way. So you get the sense of what we do, and we put the opposite one in and able to debride the other end plate in a likewise fashion. Now, once you've done that, and the way you'd know if you're completed is you can take your nerve hook and you can feel across the midline and feel all the surfaces of the superior end plate of S1, the inferior end plate of L5, feeling for cartilage, feeling for bone, just by the vibration of the nerve hook on the end plate, and that is really nice. It's all it feels rough and bone, and there's no cartilage left. The next thing we'll do, and you can use it, is the angled up curette. You see, you would stick it in this up angled fashion and bring it to you, dragging it on the undersurface of the annulus, as I discussed before, and you'll fish some tissue out. And then if you want to, you can spin it this way and peel off the soft tissue off of the posterior aspect of the anterior annulus, so there's just annular tissue and not disc material. Again, using the pituitaries provided in the set. Move all the tissue. Use the angled up pituitary. And then you can use the angled down pituitary and go in that anterior sulcus, that anterior pocket on the ipsilateral side. Okay. Now, if you're still concerned and you've still got the option of the push and pull scrapers, and you can push them in this fashion and drag it across the anterior aspect of the posterior annulus that way, and you'll fish tissue out like I'm doing there. Isn't that nice? There. Actually works nicely. And then if you want to use the pusher and scrape from a posterior to anterior fashion, then you've got this one, which will push more tissue around, and then it'll come up and surface itself like that kerosene. You can use a pituitary kerosene, whichever seems to be the most effective for you. Get all that debris. Of course, you irrigate. And to continue to debride along the anterior aspect of the posterior annulus, you could use a foraminal kerosene. We've shown you before. And just insert it so it's under the anterior aspect of the posterior annulus, and it'll bring out some tissue as well. So you're obligated to remove everything that's in there that you don't want in there, and to clean it out nicely. So once that's done and you've completed debriding it, the interdiscal space, then you're at a point where you would irrigate and then put in your bone and your implant filled with bone, and we'll show you that. We'll take a little time at this point and irrigate out for you so it's nice and clean.